Hi, I'm Eric Finkelstein. I'm the Associate Director of Health Services and Systems Research Program here at Duke-NUS in Singapore. So health services research, as we describe it, is basically any research that tries to improve the organization, delivery, or financing of health services. And so our program does a series of studies aimed at exactly that. Most of our work is Singapore-based, but we certainly are doing work within Southeast Asia as well as with collaborators from Duke and other organizations in the U.S. So HSSR is not a lab-based program, and so our research is really community-oriented, and we actually changed our name from Health Services Research to Health Services and Systems Research because we recognize the many systems, economic, sociologic, demographic, that are involved in the interplay between individuals, supply and demand for health services. And so our research, oftentimes which is done with PhD students or third-year medical students and with the input from clinicians, is really aimed at trying to improve those interconnections and ultimately improving the delivery as well as the health outcomes associated with the people that we target. One of the experiences that I found really gratifying here in Singapore is the ability to connect with the third-year medical students, to some extent our PhD students, but also with the clinicians on projects of real importance to Singapore. And so, for example, there's lots of work going on around effectiveness or built around clinical trials, and we tend not to do that research. We leave that to the clinical guys, but what we really are interested in is taking some of that clinical work and trying to figure out how can we get it out to the community. So is it cost effective? How do we create a financing system behind it so that we can get physicians reimbursed and that individuals have no barriers in terms of financing that allows them to go seek those services, ultimately to improve health outcomes. So one way I like to think about it is how can we encourage the use of high-value services and limit the use of low-value services to ultimately improve health outcomes. A lot of my research is really about health behavior. So I'm a health economist by training and not a clinician, although I get teased about that all the time. What I like to do is try to understand how can we influence individuals to make healthy behavior choices. And obesity is really a nice place to apply that work because it involves physical activity, it involves food consumption, it has to do with food prices, with information. So a lot of my research is really looking at the effects of, say, prices or information on choices. And so, for example, in the U.S., there's legislation to require calories posted on fast food restaurants. And so we just presented a study that showed that that information actually is largely ineffective. And it's largely ineffective because consumers don't see it as very salient. Now here in Singapore, the Health Promotion Board has a healthy food logo that they put on select foods. And so we've been doing some research locally. And what we find is that the health promotion logo is actually very effective in getting people to make different choices. And so one of the recommendations that we've made to the Health Promotion Board is you've got something really special here, but you need to be a little bit careful about how you use it, because if you put that, say, on a hawker center and say this is a healthy hawker center, well, they all don't serve healthy foods, and so you might end up encouraging people to eat at one hawker center but not necessarily the foods that are healthiest. And so we're working with them to come up with strategies aimed at helping consumers make good choices. So Singapore has a tremendous track record of doing clinical and bench sciences, but in fact, health services research is really nascent in Singapore. And so what we're finding is that clinicians have lots of ideas, but not a lot of training about how to apply health services research, beyond a few specialty areas which are really, really outstanding. But that's great for us because it means there's lots of untapped potential. And so our biggest challenge so far is really finding enough time to work on all the exciting projects that we've been encouraged to look into. And so, for example, I have two studies actually right now looking at the extent to which consumers should be genetically tested, because one of the hot areas of drug development and design is that certain drugs work on people with some genetic characteristics and not with others. And so the question is, should we be genetically testing? Is it cost effective? Does it ultimately improve health outcomes? And those are classic health services research questions and very relevant to Singapore. And so a couple projects right now looking with the Health Science Authority on exactly those questions. One of the other areas that I spend a lot of time thinking about is health insurance design and reimbursement systems. And in the U.S., they've gone in a very different direction than in Singapore. Singapore is really the individual first, then the family, and then government. And in fact, their health insurance scheme is focused around that. So there's a MediSave account, but you can tap into your family's MediSave account, and then there are some safety net programs. And there's lots of benefits to having this type of design in terms of creating incentives for people to appropriately spend their resources, but it's also creating lots of challenges because as people age, there's concerns about whether their MediSave savings are going to be enough, and how do we fund programs to ensure that people engage in healthy behaviors. And so our department is really looking holistically at all of the issues around aging and health insurance design and healthcare financing, cognitive impairment, so that we can make recommendations to the Ministry of Health about some potential changes that will ensure the resources as well as the services are available for the aging population in Singapore. So it's a really exciting area to be working in. Our program is really special in that it's very multidisciplinary. In fact, David Machar, who's the director, is a physician by training but does lots of modeling. I'm an economist by training, and I do lots of work around health services and public health. Angelique Chan, who has an office next to mine, is a sociologist by training who does lots of survey research. And then next to her is Young Do, who's a health policy PhD from University of North Carolina, and then next to him is a guy who is a PhD in systems dynamics modeling. And so we really span the breadth and depths of the types of disciplines that are required to do multidisciplinary research in health services. And of course, the other piece of this is the clinical side. So we really need clinical insights in order to be ensured that we're asking the right questions. And so, you know, this services and systems perspective, multidisciplinary nature is really what's required to be successful. And so that's really what we're trying to build here in Singapore. You know, I'm having a fantastic time. So we've been here 2 years, and I have children in local schools here. My wife is really enjoying it. We've been able to travel the region. We've been to Thailand, we've been to Vietnam, we've been to Cambodia, we've been to Malaysia, and we're headed to Australia in a year. So the opportunities for travel are fantastic. We're enjoying city life. I don't have a car. We walk everywhere. It's just a neat experience, and we're very happy to be here.